Good evening, everyone, and welcome to the January Global Health Tuesday seminar. My name is Jim Conway. I'm an associate director at the UW-Madison Global Health Institute, and I'm also the director of the Office of Global Health here at the School of Medicine and Public Health. We're really excited for our first webinar of the season here, and we've got some really special guests that are going to take us through some really interesting conversations. As many of you know, the Global Health Tuesday seminar series hosts researchers and practitioners from the University of Wisconsin-Madison, as well as our colleagues both in the region and around the world. The speakers showcase the complexity of global health challenges and the many kinds of expertise needed to address them. By sharing their experiences with the campus and Madison communities, these guests provide insights into global health, encourage conversation, and help connect colleagues locally and globally. Today's webinar is a discussion about How I Live, a film that looks at how 4 families in 5 countries struggle with a child's cancer diagnosis. If you haven't had a chance to watch the film yet, it's going to remain available to us through tomorrow. You'll find the information on our website at ghi.wisc.edu. I really encourage everybody to see this, whether you're part of the medical field or just interested in global health issues. It's really moving. It's incredibly well done. And as a pediatric practitioner myself, really gave me a lot to think about and a lot of ideas about both what we do here in our medical care and communications with our families, as well as how other people in other areas of the world struggle. And it reminded me that we're all the same, but there's so many differences in the situations that we live within. So I welcome all of you. We've got a great panel that's going to lead us through this. I'm going to turn it over to my colleague, Irene Albanti from Harvard, who's going to introduce the rest of the team and move this forward. Thanks again for your participation, and hopefully you'll be able to enjoy the movie if you haven't seen it yet. Irene, you can take it over.
Great, thank you. Well, welcome everybody. Thank you for the introduction. Thank you, Anne and Jim, for inviting us. Our team is very excited to be here. We are always happy to be among global health-minded people. And also it's your first day back to school, so it's an extra honor for us. As you mentioned, my name is Irene Albanti. I'm the Executive Director of the Harvard Humanitarian Initiative. And in this role, I lead our strategy and global impact. I oversee our programs in research, education, and capacity building, mainly in humanitarian and crisis settings and emergency medicine, as we are jointly based at the Emergency Medicine Department at Brigham and Women's Hospital. Before that, I was the director of the Global Health Initiative at Dana-Farber and Boston Children's Cancer Center, where I managed our international research and childhood cancer projects. In that role, and since 2014, I have been serving as the consulting producer on the How I Live documentary, which is the focus of today's discussion. As the consulting producer, I collaborated with a team at Persistent Productions to guide the early research phase of the film, provide support throughout the various phases of the production and editing, and offer ongoing scientific and public health expertise, and also access to the filming locations that you might have seen and connections to the local community. It has been my honor to work closely with Megan Shea, co-founder of Persistent Productions and director of the How I Live documentary. Megan will tell you more about the film a little bit later. It has also been my pleasure to work with Dr. Soad Fuentes Alabi, who wears different hats. She's a pediatric oncologist from El Salvador. She's currently consultant at PAHO and one of the stars of the How I Live. So if you watch the film, you can now see her in action. So I will invite Megan and Soad to briefly introduce themselves, and we can then move with our presentation. So maybe I can start with Megan.
Hello, Irene, thank you for the introduction, and thank you all for joining tonight. It's wonderful to be with you on your first day back and to be presenting, a documentary that is near and dear to our hearts. My name is Megan Shea. I am one of the co-founders of Persistent Productions, a social impact documentary production company based in Boston and in Singapore. And I have had the privilege of, for the last 7 years, working and collaborating with Irene and then with Suad on the making of the film, and then also in the impact, distribution, and advocacy surrounding the film. We look forward to telling you more about that during our presentation tonight. Suad, over to you.
Thank you very much. It's for me a great pleasure to share the screen here with Irene and Megan. As Irene mentioned, I have different hats. I work as a scientific director of the Pediatric Hemato-Oncology Day Clinic and Population-Based Cancer Registry in El Salvador, Central America. And with the St. Baldrick's Foundation support, I was able to obtain my master in public health from the T.H. Chant School of Public Health at Harvard, where I had the opportunity to be mentored by Irene. And eventually we start collaborating in different efforts to approach the equality access of care for children with cancer in low middle income countries. I had the opportunity to be part of the Lancet Commission for the childhood cancer approach in low middle income countries. And as well, eventually this took me to work with the Pan American Health Organization in the implementation of the Global Health Initiative for childhood cancer in Americas. And as a part of these all activities, I was able to participate in the film with Megan Shea. And we had, with this initiative of the film, we start identifying different activities that eventually had been emerging with this amazing team. So thank you very much, and I am glad to be here.
Well, thank you both. And so during the session today, we will be using the How I Live documentary to lead a discussion about healthcare delivery in resource-limited settings using global childhood cancer as our case study. So we have prepared a few slides to start the discussion. We will watch a brief clip, and then we will work through a few exercises together. For now, we will start with the first quiz of the day with these two numbers that you see on the screen. And I would like to ask if anybody knows what these percentages represent. You can unmute yourself, or you can enter your response in chat. Just think about what these numbers may be.
Overall survival rates for childhood cancer within developed countries versus developing countries?
Yes, we got it with the first response. This is great, although this is maybe a little bit of a biased group. Maybe you're already familiar with that. Yes, that's true. So it's actually both what you said. So the majority of children with cancer live in low and middle income countries, 80%, but the 20% or less survive in those types of settings. The exact opposite is true with higher income countries, where 20% or less of children with cancer live, but at least 80% or more survive. So we see this great disparity globally. And can you think of some initial reasons of why we have this survival disparity? Perhaps depending on your specialty or background or training.
Access to care.
Access. Mm-hmm.
Money.
Money. Money, always a good answer. Literacy, correct. Other thoughts? Well, all these three options, answers are all great, and they go back to what Jim mentioned in the beginning about the complexity of the global health challenges and the global health system addressing one issue. So it will be great if you can keep these ideas in mind while we are watching the short clip. And for those of you that watched it already, to go back and think about how these things like access, money, literacy connect to what you saw. And then Megan will continue with the next slide.
So much, Irene. What we wanted to share with you today was a little bit about how the film came to be and the journey in terms of the partnership and in terms of making the film. So the film, How I Live, was born out of a unique collaboration between Persistent Productions, a social impact documentary film company, and the Global Health Initiative at Dana-Farber Boston Children's. At the time, Irene was the director of the Global Health Initiative, and I came to Dana-Farber Boston Children's actually by way of being a patient family. My brother Matt had been diagnosed as an adolescent with cancer, and he lived for 10 years with the disease before losing his life. And so in some ways I really came of age by way of spending a lot of time in pediatric oncology units as a patient family. It was an issue, obviously, that really shaped my family. And in conversations with his care team, his Dr. Carlos Rodriguez Galindo and Irini, I began to learn more about what the global picture looked like, really the survival gap between high income and low income countries that we were just speaking about. And as a filmmaker, I was really curious. What were the causes that were driving those statistics? And then as a patient family, I was curious, well, what did the journey look like for other patients and families who had had the experience of childhood cancer? What did their journey look like? How were they coping? What was their care team? What did their providers' journey look like? And so those were really the questions that began the How I Live journey. Through the process of making the film, we spent about a year doing research, visiting different partner sites of GHI. And then one of those sites brought us to Suad, where we worked closely in making the film, and we've gone on to do a number of other initiatives, including this educational distribution and advocacy that she'll share more about tonight. The film, as many of you know who've seen it, documents the difficulties of accessing treatment and care in low resource settings. And while some of those challenges are specific to cancer, some of them are kind of indicative of systems-wide healthcare challenges that go beyond cancer. So we ask you to kind of keep some of those things in mind as you think about the film. And then we know some of you have had the opportunity to watch the 90-minute film, and some of you may not have, or some of you may have watched it a while ago. So we thought for the purposes of the discussion tonight that we would show you a short clip, so a little over 10 minutes, and I will drop the link to that in the chat. And so we thought we could just kind of refresh your memories, give you a little bit of a taste of the film if you haven't seen it yet. And then we'll use that as kind of a discussion point for some of our next discussions and interactive moments in the film. So what I'll do here is I will drop a link to the 10-minute clip in the chat. And we'll be here as you're watching. And if you don't mind just kind of, turning your video back on or giving a little hand wave once you're finished, then that'll help us know that we're ready to start back up again. So hope you enjoy and hope you enjoy again.
Oops. I was looking for a password. It's looking for a password, it seems like. Oh, there it is, sorry.
Yep. No, and thank you for the prompt. The password is HIL, all lowercase. right. Are people close to finishing? Or maybe what I'll do is we'll start the next part of the exercise, and if you are continuing to watch, then we welcome you to do so. Part of, you know, what we value about the medium of film is that it can elicit so many different information, but also emotions from the audience, and especially with a piece like this, we wanted to kind of honor that and make some space for the different emotions and the different reactions that can come up in watching the film. And so one of the exercises that we've done, I think at all of our screenings so far, is we've invited the audience to create a word cloud from their experience watching the film. And so we'd like to invite you to participate in a word cloud with us now. I will share my screen, which will have the information on it about where to enter the link. But if you have not participated in a word cloud, it's a way that we have a collaborative experience of you know, sharing a word or a feeling that the film created. I will share my screen, and we will see where you can share the information for this word cloud tonight. And as people submit words, they will show up on the screen. And you should be able to see your colleagues' responses. So give you about 1 minute. I just want to make sure I'm sharing the correct information. If you go to Pull Everywhere, / Megan Shea 970. And let me just make sure I'm in presentation mode for the correct page. I do not think that I am.
Oh, that was working okay. We could see that.
Oh, it was. Okay,
Yep.
Great.
Yep.
Sorry about that. I will share it again then.
Yep, you're back.
Great.
Perfect.
Thank you. Starting to see answers come in: hopeful, resilient, heartbreaking. Frustration. One of the things with the word cloud also is that the same word gets used numerous times, it grows in size. And so we've had a lot of, I would say, similar feelings, but articulated very differently across different groups. And so you can watch this one continue to grow. Illuminating, sad, resilient, love, lucky, insightful, enriching, frustration. Thank you all so much for your responses. And I'll leave this open so it will continue to grow if you keep adding to it, either throughout the presentation or some of them just coming in now. But we keep a record of all of the reactions from all of the different screening groups. So thank you very much for participating in that. And I will pause that screen share and head back to our presentation. And over. Sure. For your patience as I get to the right screen. Are you all able to see the PAHO workshop slide? Wonderful.
Yes.
Lord, I will hand it over to you.
Thank you, Megan, and thank you everyone for sharing your thoughts about the films and the feeling reactions that this film shows or create in you as a professional. And we also created a word cloud at a recent workshop that we developed in 2021, addressing all those stakeholders that are working to provide care for childhood cancer in Americas. And this was for the implementation of the Global Initiative for Childhood Cancer in Central America, Dominican Republic, and Haiti. The workshop was a way to emotionally connect each participant and active member in the comprehensive approach to the pediatric cancer patient with the Global Initiative for Cancer in Childhood. We asked participants for feedback, just as we asked you as a part of our empathy mapping. And you will see that the responses are in Spanish. You will see the word hope, that is esperanzada, or the word committed, that is comprometida, that are the bigger ones, the two biggest ones that are highlighted here in the slide. So this was a really important part of the connecting the participants as stakeholders and what they can do for childhood cancer in the region. The following slide. And as you know, childhood cancer functions as the interface of two traditional public health sectors, cancer and child health. And by strengthening health systems, when you see back the prior slide that we were trying to connect with the stakeholders, is a way to work strengthening health systems towards attaining the United Nations 2030 goals. And so we are going to talk a little bit about the United Nations Sustainable Development Goals. And as we discussed earlier, some of the challenges that these patients, families, and providers face are unique to childhood cancer, but many are representative of a large global challenges. The Sustainable Development Goals are a blueprint published by the United Nations to achieve more sustainable future for all. They address the global challenges that we face and are meant to serve as a global agenda for sustainable development through 2030. And they are ambitious and are interconnected in the scope. So some of the sustainable development goals that are related to childhood cancer approach and that will create a way of improve the equality for children with cancer to access for assistance and medical care is the global sustainable development goal number 1, that if we end poverty in all its forms anywhere, we will try to provide, or we will try to strengthen health systems to financial protection from catastrophic illness like cancer by reducing poverty as well. We have also the goal number 3, that investing in childhood cancer supports attain of multiple related targets, like ensure healthy life and promote well-being for all ages. Goal number 4 is to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. educational service need for children with cancer requiring prolonged hospitalizations is a way to also improve the opportunities for children with cancer. As well, goal number 8, that it work is centered in promote inclusive and sustainable economic growth, employment, and decent work for all. And we can talk a little bit about other ways of supporting the families to be able to provide, to take their children's for their to access to healthcare. And the goal number 9 is build resilient infrastructure, promote sustainable industrialization and foster innovation. And goal number 10, for instance, reduce inequalities within among countries. And goal number 17, that is to strengthen the means of implementation and revitalizing the global partnership for sustainable development. Think back to the film and that you just watched, and there is a scene or a moment that illustrates one of the challenges addressed in the Sustainable Development Goals that you can think about. We will give you, everyone, like some minutes to have like a brainstorm ideas on their own, and then we will come back together to see if you can relate part of the films that with these Sustainable Development Goals.
Wow, we're getting some wonderful responses here in the chat. And so I'd be happy to read some of the comments from the chat, but I know we can also take some if people want to unmute themselves and speak. I see decent work. The father of the little girl had to take time off to do illegal work to pay off the loan. When we think about what makes countries richer and therefore able to strengthen systems, that includes toxic practices that increase cancer. Another comment says they spoke of bankruptcy and debt, which speaks to goal number 1. These are all great answers, so thank you for your contributions. We gave ourselves the same exercise when we kind of looked at this lens of what are some of the public health and global health themes that come up in the film, and what were some of the places that we saw some of those same issues in the scenes in the film. A number of the ones that you've mentioned reduced inequalities, no poverty, the issue of abandonment due to treatment for access to care, decent work and economic growth. But if anyone has, if there are other, I see another response in the chat, number 10, reduced inequalities. Cannot help but think about how insurance covers care in developed countries, but clearly finance is a barrier for many of these families. Absolutely. I think that was one of the most pressing issues that we tried to look at when we were filming, and think about how we could make some of those real issues come across to the viewers. So there's no right and wrong answers here. We thought this was just kind of an important lens when thinking about the film and some of the larger structural issues that we saw and observed.
So we will move with our discussion question number 2. So for this, we're going to do a breakout exercise, and we're going to use the breakout rooms so that you can discuss some ideas with your team members. So we would like to ask you to identify one of the major barriers in accessing and delivering childhood cancer care in low resource settings, as we saw it in the film, and design a hypothetical intervention utilizing your team's expertise. Of course, we cannot solve the issue of global childhood cancer in 5 minutes, but connect a little bit the issue, the global health challenge, and the possible scenario given the current situation that we saw in the film. So we are going to send you to breakout room to discuss this question. You can work in your group. We will give you about 5 minutes. You will have a 30-second warning before the breakout rooms close, and then we will invite you back, and the teams can share a couple of these big solutions that we will come up with in the next 5 minutes. So I think we can send people to breakout rooms and start thinking about SDGs, problems, solutions.
Hi, how's it going?
Good.
Hello.
Hi.
Hello.
So, do people wanna, I don't know, like down their specialty or expertise, maybe, and see?
People want to start their videos while we're in this little room, maybe? That seems better. And I'm guessing that you all probably have more expertise than I do because I'm just an organizer here. So go ahead.
Do you have like the specific question that was
No, I was wondering
asked?
that
Okay.
myself.
The question was asking like to identify a major barrier in accessing and delivering like cancer care.
Okay.
And then we have to like design an intervention utilizing our field or future field of expertise.
Oh, okay.
Good for you.
Yeah.
I guess one barrier, I'm a pharmacy student, so I guess one barrier would be that like cancer medications are probably really expensive. So that would be like a big financial barrier for a lot of most families. Yeah.
I agree with that. I'm also a pharmacy student, and I agree, like cancer medications are pretty expensive, and having like access to the cost and stuff, it's definitely the biggest barrier, I would say.
Yeah, I'm also a pharmacy student. I was going to say that a lot of the issues could come from some of them might not be the most stable medications, like just storing the medications in a safe place and making sure they're all still usable when that time comes.
And they're generally not medications you can send home with.
Yeah, where's your more specialty, I think.
Yeah.
I am a nurse and I have a master's in public health. And I think that one of the points that was brought up in the video was how sometimes the cancer is competing with a lot of other like infectious diseases sometimes. So then people may not really be aware of it. And how also like there's also the lack of awareness part of, you know, like with the childhood cancers. So sometimes people have it and may not even know that they have it. I think that's also a challenge in a lot of low resource countries because they don't have the diagnostic technology needed sometimes to determine that like a child has cancer. That's one of the, yeah. So like an intervention would be like to create like an awareness campaign for a lot of like childhood cancers, and also possibly having data available to track like the incidence of like all the prevalence of like these cancers, and kind of targeting like the different areas that are being affected the most by, you know, in the language that they understand.
So for all of the pharmacy students too, do you have ideas about what to do about the cost and the instability of the meds?
I feel like the cost issue is kind of like a hard one because it can't really like change how expensive it is. And I guess you'd have to find somewhere to get the funding for it. So I guess that could be an issue, but I guess for like the stability, I guess just making sure that these like facilities have like proper refrigerators and stuff, because that could be a big cost saver for them in the future.
Other ideas? Got 31 seconds left to solve the problem.
I don't know. I was thinking, I don't know if this is possible necessarily, but I was thinking like with COVID, for example, this has been in the discussion a lot about creating more generic like versions of drugs. I don't know if that's possible for cancer care, or making them in countries that can provide the labor for cheaper. I don't know.
Okay, I think most of you are back now from the breakout session, so welcome back. So would a group like to share what they came up with during the breakout exercise?
I can share our group.
Great, Krista.
Hi. So we talked about what would be helpful that could address a lot of the things is if we could create more drugs that can be taken orally and that have a more stable shelf life, so that patients don't have to travel to the hospital necessarily every time they need treatment. They can take it at home. And that could also, you know, decrease waste, because a lot of times when you have to mix chemo and then you have to use it within a certain amount of time, obviously with an oral drug, that's not the case. You don't have to keep it in a really, really cold freezer. You don't have to protect it necessarily from a ton of light. So we thought that would be something that in the future might improve the treatment of kids with cancer in low and middle income countries.
Yeah, that's a great idea. And this goes back a little bit to how we think about it as a systematic approach and how we go with the location and transportation as the issue, and then think about a supply chain and operations type of solution to tackle the location, remote area issue. Great. Any other things? Yes, Jonathan. If you would like to unmute yourself, Jonathan, we would be excited to hear your solution.
Yeah. Now, we talked about increasing availability for screening because some of these childhood cancers are not hard to detect. And to the extent that these are preventable, if there could be increased early screening, that'd be the ideal thing that we talked about.
Mm-hmm. That's great.
One thing.
Yep. And we think about early screening, we think about correct screening, we think about access to screening, we think about healthcare providers being able, trained to provide screening. So all these things together. Great. Any other idea from another group?
So my group talked about the access for like the cancer drugs after the kids may get out of the hospital or while they're in the hospital still. So most of their treatments are provided for free, it sounded like in the film, by like the government or like taxes from the city. But another important issue to address is like, how will the family pay for the drugs maybe if the kids have to be on it for the rest of their life? And I'm studying pharmacy, so one thing to work towards is lowering the cost for those who may need it most for any of their cancer drugs, I guess.
Mm-hmm. Yep, great points, both the access to drugs and yes, and the entire financial access, so whether who is covered, who is defined as a child even, you know, the age may be different, what's the insurance system, if there is any. So all these questions are great. Maybe we take one more and then we can move to the next question. Any volunteers?
All right, so I was gonna say my group, one of the points we talked about going hand in hand with screening, I think is also increasing awareness of some of these childhood cancers. Like a lot of the like countries, like low resource countries, sometimes like they have the competing infectious diseases on top of the cancer. So sometimes like people are not really aware of what to look for that might be pointing at cancers, because maybe going to the doctor is not something that people do on a regular basis. And sometimes like even like in the healthcare facilities, they might not have some of the diagnostic technologies needed to like detect cancer. So I think, going hand in hand with the screening is also increasing the awareness of some of these conditions too.
Yep, definitely. Great idea. And thinking about awareness during regular pediatric care, perhaps, or awareness in how this relates to stigma, perhaps in other settings, or how familiar perhaps communities are about cancer, whether it's curable or no, or awareness about access to care, where they can find care. All these are great ideas. We will move to the next question, and then we will slowly wrap up with a short Q&A session.
In our final question, we'd like to ask you to think about, how your experience of learning about global childhood cancer from a film is different from learning about it from a news article, from a research paper, and just wanted to hear kind of your thoughts on the pros and cons of storytelling as a means of public health awareness. And so this is really open for conversation. You can think about it a little. We can take answers in the chat, or you can unmute yourself and we can just have a conversation. And with the screen share, I'm not able to see hands. So if anyone is raising a hand, Irini, let me know, or just jump in and unmute yourself. So.
I would just say, I think delivered in this medium of a documentary makes the information, I think, more accessible across all sort of understandings of the medical world. You know, I'm a pediatric hematologist oncologist, so this is like, it's right at home for me. But I think as I was watching it, it kind of struck me that I just wish I could share it with everyone, you know, and that I think, you know, my non-medical family could really get something out of this. You know, I wanted all of our fellows and our trainees to see this. I just think that it makes it more universally available, I think. And some of the most powerful parts of it, of the film, were when there were no words at all. And just seeing a visual of the journey, the literal journey that people had to make just to get to the hospital, I think that just speaks volumes. So I loved this format, and I thought the film was incredible and very well done.
Thank you so much.
Megan, in the chat, Krista wrote that putting a face to the name, so to speak, getting to see the kids in their respective hospital and seeing the raw emotions of the family. And also Morgan mentioned that more emotion is portrayed in the video compared to a paper. We can see those impacted rather than imagine who they are.
Well, thank you so much for the comments and the feedback. You know, I think back to when we were first, you know, looking at making this film and the goals, and one of the kind of goals for us was really to humanize the experience of childhood cancer through the stories of individual patients and really their family, kind of a portrait of their family as they experience this. So those comments, yes, thank you for those comments. And, you know, I think from here we'll transition into a question and answer. You know, we have about 10-15 minutes left. So we'd love to kind of hear if you had more thoughts or more questions. And yeah, thank you so much.
I would love to know a little bit more about the filmmaking process. You know, if you follow this film tells the story of a select handful of patients, but, you know, particularly with Gabo, right? The kid goes on to speak at the United Nations. Like, you couldn't have envisioned that when you first started following his story, or if you could, wow, that's really cool. So how many children's stories did you film? What was that process like of, I know it sounded like you chose GHI partner hospitals, but what was that process like of choosing patients to follow? I mean, it was such a longitudinal experience, and I'd love to hear more. That just seems like an incredible amount of work.
Thank you for that question. I'll start it, and then I'm going to hand over to Irini for part of it. But we knew when we started out that we wanted to capture kind of the experience of childhood cancer in the sense of like through treatment. Not that every patient had to be start to end of treatment, but we knew that we wanted kind of something longitudinal to a degree, so that we were kind of anticipating filming for years. But of course, a lot of that would be unknown, and we couldn't exactly plan, you know, the course of what the patient's journeys would be like in terms of care. And so, you know, as we mentioned, and you mentioned, we looked at GHR partner hospitals and partner sites, and knew that we wanted the film to be kind of representative in some way of the global picture. While it couldn't, of course, tell the story of every child or be kind of like mathematically perfect, we did want it to be somewhat representative. And so, Irini, can I hand over to you for the how we looked at that decision matrix a little bit?
Yes, sure. So of course, we had the artistic approach and inspiration for the film at the same time, and this is where the collaboration between me and Megan and her company emerged. We wanted to have a data-driven, systematic approach to how we design the scripts, the questions that are included on the film, and how we select the hospitals and the patients. So, and as Megan mentioned, to have it representative in terms of gender of the patients, location, religion, culture, staging, diagnosis, type of cancer, ages of the kids. So a little bit of everything, although of course, even if it was focused only in one country, it wouldn't be possible to have all patients and all cases of hospitals, but a little bit so that it is representative enough. So when a patient from Guatemala watches the film, to be able to connect. When a nurse from Ghana watches it, to be able to connect with a nurse in Myanmar. And from the screening that we had with some of the healthcare groups, it seems that this is one of the things that people have mentioned, that although they've never even heard of another country or been there, they were able really to connect with their colleagues in another place or other patients. So that's the approach that we developed. And actually we had a table with criteria and weights, and we ranked every hospital, and we assessed really all these things, where we have access, when we can go, where we can find the patient, where it would be possible actually to follow patient in their families, in their homes, on the bus, in the patient room. So we consider all these elements, and then we came up with the 4 or 5 stories that you saw in the film.
And I'll mention a little bit more about the, from the filmmaking side as well. I think we made a poster about the process, a scientific poster, yet another collaboration that I learned about in the process. But I think we went to each location about 5 times. Even within that pretty comprehensive on the ground approach, we knew that there would be things that we wouldn't be able to be there in person for. And so in each location, we partnered with a local production company and kind of collaborated with them in the making of the project. And so we were in kind of constant communication with them and with the families. And so we knew we had certain points that we wanted to capture in terms of, okay, they're going in for chemotherapy this day, or that's the anticipated date, but maybe something happens in between and we want to be there. And so our team on the ground could let us know if something came up, and then they could be there physically present and filming as well.
And I see Jim has a question.
Yeah, it's sort of a follow-up to Kathy's question, because I'm very interested in the making process, but we're also really interested in sort of the ethics of all these kinds of things. You know, we spend a lot of time with our students and residents that travel in helping them, you know, really make good decisions about getting consent and approvals for these kind of things. So I guess I'm really curious how you both identified and recruited these kids and their families, and what the consent process is for this kind of big movie production, especially since there's so many other people in so many of the shots, and how that works.
I can start with Magnon, and I think Megan has some more to say about the consent process, and then perhaps Suad, because she's one of the sites where we were filming. So I will start by saying that it all really started with open communication, a good collaboration and trust, because if this is, as it took so many years, besides the IRB consent process, even if this didn't exist, still you need to be able to have a very good collaboration and trust the teams on the ground to be able to start this discussion, even the joint interest, and then think about what patients, when is the proper time, what is acceptable. So my note is a little bit the umbrella note, and then perhaps Megan can talk about how you take this on the consent, the more technical, and maybe Suad from her side, since we've been at her hospital for so many times at this point. So she can tell us about the other side, what it is to have a film crew or somebody from another environment coming in and thinking about how to film, when, what time in your unit, because in any case, this is invasive. Even if it was here at Dana-Farber, you still have a crew next to you at the same time. So maybe Megan, you can add something.
Sure. So to build off what Irene was saying, you know, initially when we approached the partner sites during kind of the year of research, we went and we said kind of, this is the intention of making the film. This is kind of what it would entail. Is this something you'd be interested in doing? Would you want to host us? So really looking at places that, you know, people wanted to embark on this kind of journey with us. And then from there, kind of working on an individual basis with each of the care teams to say, bringing in psychosocial or bringing in kind of the team and saying, do you have a patient that you could recommend? how do you think we should approach them? And so kind of working collaborative with the care team. And then from there, on kind of like an individual patient family perspective, working with the doctors, our translators, and saying, you know, kind of explaining the process of making a film and kind of what that would entail, getting their kind of written and verbal consent, but also kind of working with them through the process to say, like, if this is something that at some point you don't want to continue to participate in, that's okay too. You know, so we started actually filming with more, anticipating that there might be some attrition for various reasons. We actually started filming with a couple patients in each location, which we capacity wise would be too much, but we just thought, you know, of course, you never know what's going to happen. So from there, and for the patients that we continued to work with and were welcomed by them and their families, that those kind of became the patients that were featured. So if you want to add anything from the provider side.
Yes, I think that this was for the hospital and the foundation for each of the countries that participated. At least I can talk for Guatemala and El Salvador, that where the treatment of childhood cancer is a tripartite alliance, like government and foundation that support childhood cancer treatment in these countries. And this was an opportunity of political opportunity from the point of view that was kind of portraying what each program has attained along their years that they have worked improving access to care for childhood cancer to the world. And the authorities identified by filming or participating in this film an opportunity to also present that there is a program that offers treatment for children in the country. And one of in the discussions in one of the breakout sessions, they mentioned that since the inequality in childhood cancer treatment is multifactorial, one of the multifactorial factors that intervene in decreasing this inequality is the lack of access to knowledge that there is a program that provides provides treatment for childhood cancer. And in this thought is that why their authorities were willing to participate in this film and authorize the filming crew to enter to the hospital facility, to the facilities and to film. And then the other approach with the family, when we evaluate which kid would be an excellent candidate to portray in the film, we talk about the importance of why we were doing this film and the opportunity that this kid later became an ambassador for the United Nations Global Assembly in 2018 to launch the Global Initiative for Childhood Cancer. So the family expressed that they were committed to participate in the film, since this was a way of saying thank you for all the effort that the different stakeholders were making to provide care to their child. So I think that the main thing was this political moment that was the global initiative being launched, and the fact that the governments felt that was an opportunity to portray the work that is being done, and how much work is still to be done to improve access to care for children with cancer.
I like the awkward silence of seeing if somebody else has anything else to say or ask
exactly. I know I'm trying to look to see if there's any hands raised anywhere down.
What is your plan going forward? I mean, this is such important stuff for so many different people, both within and without the healthcare industry, to understand these personal sides of things. Like, what's the plan for getting this out there that people can see and understand this?
Great question. Thank you for the question and the comment. A few different plans. So, when the film was released, it was January of 2020. And so we had great plans for a world screening tour, which as everything was very interrupted. And of course, while that was in some ways a big challenge to the film release, in other ways, we adapted or I like to think very quickly to a virtual screening. So the film's been playing at film festivals, kind of with a cinematic audience. But we've also had a lot of interest from schools, universities, schools of public health in screening it. So because of that, we really developed this for a few reasons. We wanted to engage with students. That was always a part, students, faculties, professors. And we've been showing it in kind of a number of different capacities. We've shown it at Grand Rounds. Right before closed, we showed it at Grand Rounds in person in Toronto at Sick Kids Hospital. And then everything quickly moved virtual. We've shown it at noon conferences. And so we're really keen to continue this type of work. We also have an IRB study when we get back to doing in-person screenings about social impact filmmaking and storytelling. So maybe if that day ever comes for in-person screenings, we can come back and do a screening with you all. But we definitely are interested in continuing to share it. So if you have colleagues or classes or audiences that you think would enjoy it, please stay in touch and let us know, because we're really interested in staying active in this distribution education space.
That's great to hear, because I mean, we have such a large and growing global health community here at University of Wisconsin-Madison, between the Global Health Institute and all of our partner organizations. And I do think that there's a lot of, obviously today's the first day of the semester, and roping in undergrads at this point and their professors is a little challenging. I mean, I was happy we had as good an attendance as we did. I think most of us thought the semester actually started last week. And so that when we scheduled this, we thought, because it usually starts the day after Martin Luther King Day, and we thought, oh, this will be great. They'll have a week under their belts. And then they move the goalpost on us again, like everything seems to happen nowadays.
Yeah.
So I think there are, rather large audiences. And again, both within healthcare and from people that are sort of in other areas that I think really need to understand. I mean, that's the whole idea of global health, is it's not just the healthcare part of the organizations that need to think about this. It's everybody else. There's health in all policies and health in all activities. I mean, people really need to think about the impact that they can have. And I would love to see this as something that more of our undergrads who are contemplating their role in global health could see and really benefit from. So we will indeed stay in touch, and happy to endorse it, and certainly would be interested if we could figure out a way when it goes more in person routinely to be able to see if we could help you study sort of impact and future ideas for people after they see it.
That would be wonderful. So I'll hold on to that for the dream of in-person screening with you. That's our real.
Well, we're really committed to getting back to in-person, and I can't thank Irene, Megan, Sawad enough for your time, because I know you've done this many times, but it's really meaningful for all of us. We really appreciate you sharing the film with us. I want to thank Dr. Kathy Lee Miller for putting you on our radar and connecting the dots here to make this work, and appreciate everybody's flexibility. I wish you luck with this. I think this is really important work. We have some other great cinematographers here on campus as well, and actually one of our next events, I forget the date. I don't know if Anne's still on, that she could help me out, but actually we have another film screening event coming up very soon in February. Wait, I found it. Greg Mittman is the Vilas Research and William Coleman Professor of History of Science, Medical History and Environmental Studies. and he actually has a new book called The Empire of Rubber, which was released recently. And so he's actually our speaker for our February 22nd seminar. He's also a filmmaker and has done some really meaningful work in that space as well. So we have a legacy of this kind of stuff at University of Wisconsin, and this really does fit in with a lot of the other things that we like to do. We also certainly like to do multimedia type things to really keep it diverse. Kathy just wanted to throw in a reminder for me to shout out to Krista Grindle, one of our physicians here, who actually is the one that discovered the film and put it on Kathy's radar. So that's how these things work in many ways, kind of word of mouth, really.
Thank you, Krista.
Yeah, so this is really important. We really are incredibly impressed, and you must be very proud of your work. And we'll do whatever we can to help promote it as well. So thank you for your time. Thank you, everyone. Please spread the word about these kinds of important events, and put on your calendar February 22nd at 4:30 p.m. when Greg Mittman is going to talk about his new book, The Empire of Rubber, which I think is going to be absolutely fascinating. But thanks again, everyone. Please stay well. We're really committed to trying to keep the University of Wisconsin in person. And when we can get into larger events, this would certainly be something that would be great to sponsor at one of our movie theaters on campus.
Thank you so much.
Thank you so much. Thank you for having us.
Thank you so much.
Thank you very much.
Come back again sometime in person.
Yes, please.
We hope so.
All right. Stay well, everyone. Thank you.
Thank you.